Today, we have Dr. Violet Borowicz, Carilion peds hematologist and oncologist, Tammy Campbell, Director for Care Connection for Children, Jennifer Clemo, Care Connection Case Manager, and Patricia Fellabaum, Educational Consultant with Roanoke City Public Schools. They are going to talk to us about Care Connection. Dr. Borowicz, I'll hand it off to you.
All right. So we are going to go just talk briefly about what Care Connection is and go through how to access our services and what services that we can provide to our pediatric population in the Roanoke Valley. We have no financial disclosures. Care Connection for Children is a statewide network of regional programs that provide services to children who have special healthcare needs, including healthcare coordination, educational support, community support, and assisting with locating resources. Roanoke Care Connection for Children is sponsored by the Virginia Department of Health. The Care Connection team, I am the medical director for Care Connection in Roanoke, and Tammy Campbell is our program director. Patricia Fellabaum is our educational consultant, and then Jody, Julie, Jennifer, and Bonnie are our care coordinators. There are currently 2 open positions. We are searching for an RN care coordinator as well as a office assistant. This is just a representation of Virginia and the different service areas. So Care Connection has 6 different service areas, as you can see with the highlighted areas. So the Roanoke area, which we are in the light blue, we service all of those counties that fall within that region. So my role is to act as a liaison for clinical and medical questions for patients, as well as help with transition to adult care. It is something that has been beneficial, is trying to make sure we know from all of our subspecialists who the adult subspecialists are that they tend to transition their patients to, so that we can try to work on easing the transition for both the patients and their families. The criteria for a Care Connection, they must reside in Virginia and must be under the age of 21. And the goal is to serve patients who have a condition that is of a physical basis, lasting or expected to last 1 year or more and up to their 21st birthday. This is just a couple of graphics from the Virginia Department of Health. And so for fiscal year 2020, this is the breakdown of age groups that Care Connection for Children served. You can see the biggest majority, 37%, were actually ages 6 to 13, but it does span all age ranges from birth to even a small percentage of 21 and over. And these were open and closed cases that occurred during the year 2020 and not the current active caseload. This graphic is a representation of race. So 52% of the population served in 2020 were white Caucasian, but again, it serves a wide variety within our region. And then this is also a distribution by insurance type. So the majority of our patients are in Medicaid, but we do have a small percentage on commercial insurance as well as uninsured. And now Tammy is going to go over the referral process.
Good afternoon. My name is Tammy Campbell. Wanted to talk a little bit about our referral process, which is a little bit different than the current process that Carilion uses for the referrals. Typically, a referral is generally put in with an order by a provider. So for our department, we have the referral process that you can either do by paper, or you can do it an in-basket to myself or one of our staff, or by a phone call. We receive that from the nurse or provider, or they can be self-referred by the parent or patient themselves. The referral should include a diagnosis, the name of the client, the parent name, an address, and phone number to ensure that the client is in our catchment area. The family has to consent to wanting the services for Care Connection and must give verbal consent prior to being referred to our clinic. When the family is given a consent, it can either be done by mail or in person, or we can email it to them. If they're unable to provide services within their CC center because they don't meet our criteria, we do work with their social workers and our pediatric department so that we can align them with the services that they need as well. This is a voluntary program. The parent has a choice of wanting our services or not and can choose which center they would like to be assigned to. If all of their services are being in one centralized location, they may want to work with a center that's closest to that location. Timeline for initial contact is 2 to 3 days. We make 3 attempts by phone. If we're unable to get the parent or patient, then we will send them a letter requesting a callback. We have an electronic medical record called the Sun system that we use, which is similar to Epic, that we put all of our documentation in. If after 2 weeks we do not get a reply, the pending referral is then closed and the referring agency is notified. We have an administrative assistant who reviews the documentation, which is comparable to our Epic system. The patient is given an assigned number. The information referral is then documented within Sun with demographics, and it's handed off to the program director. And me as the program director, I review the caseloads, assign it accordingly to the care coordinators, and then they begin their process of looking for what services that client may need. And now I will turn that over to Jen, who is one of our care coordinators, to explain that process.
It's going to briefly explain what we do. So care coordinators help connect families by providing care coordination services for the families. We also assist them with community resources. We do have 6 regional sites across Virginia, King's Daughter, UVA, Northern Virginia, Carilion, Southwest Virginia, and VCU. Most of our centers are located at major medical centers where families already seek care for their child. So for us here in Roanoke, we collaborate with Carilion. We also focus on transition to adult care. That's become a real important priority for us to make sure when they transition, they will continue to receive care. We also have an educational consultant on board. She is an integral part of our team and helps with special education services that so many families need through IEPs or 504 plans. This year, statewide, we served 2,800 families. Through care coordination, where our goal is to provide a team approach, and we do that by working with the provider specialist. We work with the staff there to try to ensure that the families get to their appointments. We arrange transportation. Sometimes we remind them of their appointments. We work with their insurances on different levels. We talk to them about their different options, about enrollment. We work with the case manager that they may be assigned through their insurance to facilitate care coordination. We will explore payment options if they are not covered medically. We help them navigate the community resources that are available to them so they can tap into all the services that they are qualified for. As I said earlier, we work with them for their school concerns, and then we also try to connect them with other families that are experiencing the same challenges that they are if they would like to pursue that. So the team approach pulls together care coordinators, medical personnel, educators, and family members to help determine the child with special health care needs reach their maximum potential. And now I'm going to turn it over to Patty, and she will discuss educational process.
Hello, this is Patricia Fellabaum. I am the educational consultant for Care Connection for Children. I work as a support to all of the care coordinators and their families. I am a liaison for the families who have children with special health care needs. I work in the school districts or the school systems and can discuss developmentally appropriate educational programming with families. Some of the other things I do, the care coordinator and I assist with school-based health care plans. We can suggest alternative educational programs and outpatient therapy services to supplement what a child may be receiving in the educational setting. We work together for transition planning and then after high school, those options. I can answer questions about 504 plans, IEPs. I can discuss IEP meetings and coach parents to help them understand the educational process and maybe some questions that they might want to ask the IEP team. The other things that I can do is discuss extended school year, recovery services, summer camps, residential and day programs that may be available and appropriate for their child.
So this is our current contact information. Roanoke Care Connection for Children is actually located on Franklin Road, and those are our phone numbers. You can find us both on the website for CarilionClinic.org and on Facebook. But just so everybody knows, Care Connection will be moving to Tanglewood this fall to join the Carilion Children's Move. So they will also be extremely accessible for our patient population when they are coming to see us. And if you guys have any questions, we would be happy to answer.
All right. Well, thank you guys very much for your presentation today. Greatly appreciate it.